Knowledge is the driving force of transformation. We believe that mathematics is the language of the universe, and cybernetics is the poetry of the future. As the minds behind beautiful systems and the architects of a smarter and securer world, we make no compromises in building the impossible. By creating order from chaos, we dig deeper into the core of things. Research and development are in our DNA. We rely on this background and the profound objective truth in shaping the world. We see ourselves as the guardians of cybersecurity. By initiating changes in this field, we shape the world. We believe in long-term partnerships built on trust and transparency. We work in close collaboration with our customers for the best result. Our technologies are the foundations for digital societies, creating unique value for governments, businesses, and citizens. Our products enable the identification of individuals in cyberspace, securely transfer data between stakeholders, and improve the situational awareness of our customers. We have successfully digitized areas like tax and customs, built smart grid solutions, and more. Today, our technologies are used in more than 35 countries around the world. For over 60 years, our mission has inspired us to thrive and grow into a global presence. We are committed to delivering tomorrow's technologies today.
Hello and welcome on my behalf. I am Kevin and I am from Cybernetica. We have been inventors and engineers of mission-critical solutions since 1960, as we were initially founded as the Institute of Cybernetics under the Estonian Academy of Sciences. And as we were later spinned off into a private entity, we started working on solving complex issues and challenges in governance, healthcare, and for enterprise. And this has set us up to be able to design, architect, develop, and deploy solutions for healthcare, both from a larger ecosystem perspective with key enablers, but also with more dedicated and targeted solutions that require heavy analytics and intelligence. Some of these ecosystem pieces that we work on and have experience in are, as an example, interoperability and secure data exchange. This is something that we've been working on for 20 years and have been the leading thinkers behind the Estonian X-Road model and have implemented this in numerous countries around the world. Another ecosystem level example is from secure authentication and digital signatures, as we have worked on this for the past 2 decades in delivering ID card pilots, in developing mobile-based solutions, and consulting with governments all over the world. And some examples of more specific targeted solutions are from clinical decision support tools to encrypted genome data storage and querying mechanisms, and of course to information security and privacy risk analysis for different solutions and projects. What we believe today is that a patient-centric experience without compromising security or privacy is possible. And this is possible, we believe, with 3 key areas or components in place. One of those is a health trust ecosystem, an e-health trust ecosystem that makes it possible to enable data liquidity and shared data among independent stakeholders and create bridges between silos. The other area is in information security and privacy by design, where we have a methodology that enables to create solutions and enables to unlock the intelligence analytics necessary to create these services in a way that does not infringe on the integrity of the data nor on the privacy of the individual. And finally, we believe that achieving a patient-centric experience and also bridging the productivity gap in healthcare is only possible if we build a coalition of like-minded entities. So if this makes sense to you, we are very happy to discuss further. Thank you.
Kevin, again, I would like to thank you, and your keynotes are always absolutely fantastic. I would like to ask a very concrete question from you. What's your solution for the US market? What do you offer for them?
Absolutely. Thanks a lot for that question. So as I mentioned, we work in a number of different areas, providing both ecosystem pieces as key enablers, but also specific solutions targeted to overcome complex challenges. So more specifically, what we can provide is interoperability and secure data exchange as a platform, or soon even as a service, or digital identity in a way that works on smartphones without having to use any physical security devices on the user side. And of course, looking at our information security and privacy by design methodology, we can unlock the sort of analytics and intelligence layer in healthcare, but also in other areas that's necessary to actually create solutions that can help prevent disease, to help solve diseases and illness, and also work in the sort of aftercare phase of the patients.
All right. Are you already providing some solutions for the US market at the moment as well, like working with some international organizations that especially deal with the medical information and so on? Or are there any examples that you could bring it up for our listeners today here?
Absolutely, and thanks for the question. So in other areas, we work with DARPA and then US Air Force as well, doing a lot of sort of groundbreaking work around cryptography. But in terms of healthcare, we work, as an example, with the Center for Medical Interoperability based in Nashville, and had a project together with CDC, our own personal protective equipment, in the sense of exchanging data between independent stakeholders like hospitals and gaining information about what their sort of level of equipment is in terms of masks, gowns, gloves, and so on, so that you know exactly where you have stock of something.